All right, so the physician has put in an order for a Foley catheter. I'm gonna go ahead and go over the steps on how to insert it. So first, you always wanna reconcile the order with the MAR, make sure it matches up correctly. Second, you wanna go ahead and gather all your supplies and then head to the patient's room. You're gonna knock on the door. You wanna introduce yourself, perform hand hygiene, and then you want to identify the patient in 2 ways. Also checking their identification band to make sure that it matches. You're gonna assess the client for any allergies such as adhesive taping, latex, any shellfish or iodine. And then also, as you're raising up the bed to work level, you want to go ahead and educate the client on the Foley catheter, what you're doing, how you're gonna do it, and why you're doing it, and also obtain their consent. Make sure that they have a full understanding of what's going on and that they're completely okay with it. So after that, I'm gonna go ahead and put the side rails down. I want to go ahead and put a blanket on them to maintain the privacy of them. Ask that they hold it up top while I get the blanket underneath them. Awesome. Put this in position. So now I want to assist with the position of the dorsal recumbent, making sure that their feet are 2 feet apart. Get them in a comfortable position. There we go. And then get this in position to where you won't contaminate when you have your gloves on. All right. Now that's all good. Get this up to level. Now I like to go ahead and get the taping in place so that it's easier when I go ahead and attach the tubing to the thigh. Put that right there. Place that somewhere different. Now I like to open my sterile kit and use this as a trash bag, making sure that I do not touch the bag whatsoever inside or out. Maintaining sterility and easier disposal of contaminated items. So now, I'm gonna go ahead and go away from me to the side, to the other side, and towards me. Just get this, straighten that out a little bit, only touching the edges. I'm gonna move it so that it's easier. There we go. All right, so now we have this little sheet. We put shiny side down. It's just an extra to save the linens on the bed and just in case any dribbles or any unnecessary fluid likes to come out. It shouldn't though. You don't have to have it underneath the client as long as it's close enough. And then now I'm just gonna grab the sterile gloves and put them down, only touching the outer surface. Just gonna open them up a little bit. And before I put them on, I just like to move this a little bit so that I do not contaminate this with my sterile field. First, I'm just gonna move this over a little bit so that it's easier. And then right here, I just go ahead and grab underneath and open, making sure that it does not close on me, and that there's no problems with that. Just like to straighten it out a little bit. All right, and with my non-dominant hand, I go to pick it up and I commit. You're just going to make sure your hands stay above waist level. There we go. And then you want to go underneath, make sure that your thumb is kept away. Go in underneath and commit. All right, and keeping your hands again above waist level, just you want to insert your hands into the correct placing at least. And there we go. and just with your elbow, so you don't even have to worry about sterility. All right, I'm just gonna place this to the side. Check out what's in my kit. I got the specimen container, iodine, lubricant, and the swabs. I do like to open this, drop it, and open this just to go ahead and place these in here. It's easier for me to clean. And then just drop it. The sterile water syringe to inflate the balloon, take the top off so that that's all ready. And then I'm just gonna place this right next to it, making sure that it's still in my sterile field. All right, now I like to take the plastic off, making sure that it stays in the sterile field. There we go. And dispose and just drop. All right, I like to first grab the lubricant, open it, place some on the side, have that ready. And then I want to attach the syringe to the port. Have that all good to go when I go to inflate it. All that's good. All right, now I just want to bring this up, and I'm gonna transfer this over to there. So I'm just moving this, making sure it doesn't contaminate anything. All right, now we're gonna go ahead and clean the area starting the farthest away from me, and you want to go front to back. So front to back, around the sterile field and drop. Come back, go towards you, front to back, around the sterile field and drop. And then also start in the middle, front to back, around the sterile field and drop. All right, now that that's all good, this, all good. All right, so now I'm gonna go ahead and tell the client that we're gonna go ahead and insert it. So I want to tell her once I spread the labia with my non-dominant hand, I just want her to take a couple deep breaths. I'm gonna lubricate the Foley, spread the labia with my non-dominant hand, and then I'm just gonna tell her to bear down like she's voiding. So I'm gonna go in, tell her I'm about to insert it, go in about 3 inches, see a flash of urine, go in 1 to 2 inches more, now I can grab. All right, now this is the time I go to inflate the balloon. All right, so I'm just pushing the 10 milliliters of water, making sure that that's all good. I'm gonna go, then give it a slight tug, yep, and it is in position. So now I'm just gonna take this out. It's harder when you have small hands, but. There we go. And now I can let go. So now that that is all good, I'm just going to grab the bag and make sure that this has a little bit of room and it goes over the thigh. I'm gonna take the tape and I'm just gonna go ahead and tape it to her thigh. Instruct the client to, if she does happen to get up, keep it below waist level. Now I'm gonna go ahead and attach this to the bed frame. Make sure that it is not the side rails. And then I want to assess the urine, make sure that I'm looking for the amount, the color, and the clarity. All that looks pretty good. I want to also put my name and date or my initials, the date and time. I also put in the Foley catheter. So once all that's done, just get all this out of the way, throw it in the trash, and then I want to reposition the client in a comfortable position. Maintain her privacy. There we go. Put this back up. I am going to take these off. I do like to do hand hygiene before I get this all going. Just put this back over, grab the bed sheet, place it in the basket. All right. I just want to let her know that if she does need anything to let me know. I will put the call bell within reach, put the bed in lowest position, side rails up by 2, make sure that if she wants to increase her fluid, she can. And also let me know if she does want to get up so that I can help assist her keep the bag up below her waist level. And that concludes the Foley insertion.